guys, welcome back to my channel. I wanted to do a story time about something that I've been dealing with for so long, for years. I've been dealing with yeah, I wanted to talk about something that I've been dealing with for years, and I haven't really talked to many people about it. Some of my family members know, and so something I've been dealing with: fibroids, guys. Yeah, let's talk about it. Okay, guys. So, my first experience with fibroids, I didn't know I had fibroids, but as a child, I would say middle school is when I first had my menstrual cycle, and it's always been in my mind normal, 5 days, 6 days. And as I became an adult in my 20s, I remember in college, I went to the clinic on campus, and I spoke with a medical professional at the clinic who I explained to her how I've been having an increased pain during my menstrual cycle, and just different changes as far as my body. And she proceeded to tell me that it was probably just endometriosis. I probably just have endometriosis, and she prescribed, ibuprofen, like a higher dose, like 800 milligrams, and she even prescribed naproxen. So all through my college time, I would take the naproxen when my period starts, and then I will have maybe pain again on the third day. So the first day, when I begin to feel the cramps the day before, I will take the naproxen, knowing that day one would be so excruciating. I would feel so much pain, you guys, to the point where I wouldn't even leave my house. And when I did, usually I would soak a pad. I wasn't wearing tampons. It just didn't feel right with me. But I would soak a pad like an hour and a half. And I would have the extra strength, the overnight pad. The one that, like super.
Oh,
like
hell no.
Fourth one on the box. So a few of the signs and symptoms that I did have was, of course, the excruciating pain. It was like not just a throbbing, aching, crampy pain, but like a pow, pow. It was like shooting. Like I felt like lightning was striking through my abdomen and my pelvic area. And I would be in bed. I would be crying. Oh my God, I would be sobbing and wailing because the pain was so much, and I felt like the medicine wasn't strong enough. And I will take 2, so that's what, 1,600 grams of naproxen, and I probably throw an ibuprofen on top of it, like, and I'm bleeding, but I'm making it worse with the ibuprofen. I would have warm compress or warm pads. And literally just be in bed. There were times where if I had to be out of the house or leave the house, I would literally soak through my clothes. I would have to, like, literally drive, and I'm like, oh my God, I feel a big gush. TMI. I feel a big gush, and I have to run to the bathroom. I have to pull over to the gas station, or I would have to just be home. Like, that's how bad it was. There are moments where the pain would be so excruciating, I would have to pull over and just like take deep breaths, because I have to get through it. And I know, I'm like, this is literally my life. Every time I would not want to have a period. Would not want to have a period. And I just said, women cannot be going through this. Like, seriously, this is too much pain. How could women go through this every single month? And then being so tired, just so tired. I literally, as far as bleeding, I would go to bed and I would put a towel on my bed in my lower half of my body because I always seep through. And I need my sleep, but I will always seep through my clothes and it would be on my bed. I would have like just blood pooling in my bed. It's so disgusting, but that was the normalcy of my life. Until one day, after I graduated from respiratory school, I moved back to South Florida, and I was having my cycle, and I would always sit up front with the secretary. I would always shoot the breeze with the secretary and the doctors, and we all like make a big thing. It was day shift. I never worked night shift at that point when I first started my first job. Never worked night shift, and I worked in the ICU, pediatric ICU. So I would sit up front with the secretary, and one day sitting there, I couldn't even really engage conversation with her because I was in so much pain to the point where I had my head down on the desk and I'm just like in tears, just tears. Got interrupted, but I was in tears, sobbing, and I was sitting in front at the nurse's station, crying about the pain that I was feeling. And the secretary, who I adore, she was like, "Girl, what's wrong with you?" And I'm like, "Yo, I can't take the pain anymore. I'm like literally, I feel like I'm dying every time my cycle come on. I feel like I'm dying. I'm crying. I'm like, I feel like I'm dying. It hurts. It hurts. It hurts so much. I'm so sick of it." And she was like, "Okay, your periods are not supposed to be that painful." I'm like, "Well, it is. This is normal. Everybody has it." She was like, "No, because I don't have it. I don't go through what you're going through." And it caused a crowd to come around. So other nurses came around and the doctors, and we were all talking about how that's not normal. I said, "This is my normal. Like, why are you saying it's not normal when y'all should, everybody go through this?" No, everybody don't. So I was suggested to go to see this gynecologist who specializes in who has a specialty in infertility and just everything that's not of the norm for a woman. So the secretary said something about this one specific doctor. She suggested it, and then two other nurses also go to that doctor, and they had their babies with that doctor. So I said, okay, let me go ahead and make an appointment as a new patient. So I would say maybe 6 years passed from when I went to that first doctor at the clinic to that new doctor. And so I made an appointment, and it was like a Monday. I met him, gave him my history, told him what was going on. In the middle of that conversation, he literally cut me off and said, "Tomorrow, I need you to go to this location because I need you to get an ultrasound." And I'm like, "Oh, okay. What is an ultrasound? What is that? What are you looking for?" And all that. And he said, "I just want you to get an ultrasound because I will be looking to see if you have any fibroids or any type of mass or anything going on with your uterus." And I said, "Well, the last healthcare provider I went to told me I had endometriosis." So when I had the ultrasound done that Wednesday, the next day, which was a Tuesday, and then I had a follow-up appointment with him that Friday. And then he told me, "Yeah, I suspected it. So you do have it. You have fibroids. Is that something found in your family? Anybody else with fibroids?" And at that time, I don't remember anyone having fibroids. And my family, their members are very hush-hush and secretive, and they don't really want everybody in their business. Like, my family is the type that we will sweep everything under the rug, and whatever happens in our house stays in our house. It's our business. We work on it, and then, I don't. He explained it to me. It's common in African American women, and usually, sometimes it's genetic, but mostly found in African American women. I'm not saying that other races don't have it or don't get it, but most common in African American women. So I was like, okay. And he explained to me what it was. So what it is they're like growths, mass tissue that grows in random areas of your uterus. On the inside of the uterine lining, on the outside, just various locations. I can see that. So that's what my fibroid looked like. I would have them in so many different places in my uterus. And these are non-cancers that are just placed randomly. They just grow. The main thing was he told me that was a sigh of relief that it was non-cancerous. And I'm like, okay, all right. So now what do I do? So he said, what we can do is set you up for surgery and you can get them taken out. And he said, and I think I was 26 at that time. And he said, you're still young, but you're getting older and you need to do something about that. And you need to start having children.
You acting up.
Wait a minute. I just came to get this situated. Like, bro, what you talking about? Have babies? What? Como? Come back. Run that back to me again. What are you talking about? I didn't come for all that. I just came so you can fix this problem so I can actually live a normal life. When he told me that, I was like, whoa. I was like, I'm only 26. What are you talking about? I gotta have a baby now? Like, what? He was like, just think about it. I'm just gonna put it on the table, but you're getting older, and as time continues, this is a reoccurring thing. It's gonna keep happening. And I'm like, oh my God. So that kind of put a level of fear in me, So I went in to have the surgery, and he explained to me how the surgery was gonna happen. It was an outpatient type thing where I'm there just for one day, and then I have the surgery, and then I go home and recover at home. So it was laparoscopically. So they had like, it would be like little, not even like an incision. It would be like small little holes placed into my abdomen. It was 2 on each side of my pelvic area, and it was 1 incision in my navel area. My doctor, he used tools to go in and pull the fibroids out. So that was my first experience. I know post surgery I had they inflate your belly, and so they try to deflate it as much as they can. And what happened was that air or the pain from that surgery caused so much pain in my shoulders. Jesus. I want to say maybe 2 years later, I began to start feeling tired again, and I will walk up 1 flight of stairs and I'm like out of breath. I am so tired. Just 1 flight. Normally 4 or 5 flights, I'm good, but just 1 small flight of stairs, or maybe 12 steps, and I'm like short of breath. I'm so short of breath. Like I felt like I was dying, and I just kept thinking, oh my God, I need to lose weight. And I probably was like 135 pounds, and I'm like, I need to lose weight. This is because I'm too fat. It gotta be because, it's hard to breathe and I'm just too fat. While at work, I was having my cycle, and I remember I was feeding a baby. I finally got a break from being on the level 3 crazy chaotic side where I'll go and see, go to deliveries and get the babies, So anyway, I'm now on the more calmer side because I think I asked to have that side to get a break from the crazy side. And I remember feeding a baby, and I literally would hold the baby after I fed, because she had reflux, I believe. So I would hold her up after feeding her so she could digest it a little bit before I put her back in her crib. And I remember I started nodding off holding this baby. And I was so tired. I was starting to fall asleep. And I'm like, it's only 11 o'clock. Why do I feel like this? I put the baby in her crib. I got up, got out, soaking wet again, as normal. And one of my coworkers said to me, Army, are you okay? And I'm like, yeah. She's like, you do not look okay. You look gray. You look drained. You look so tired. You look like you're about to pass out. And I'm like, oh my God. That's why I feel like this. I think that my fibroids are causing me to have other issues. I think it's just because I'm bleeding so much. So I did mention it to my doctor, and he said that since you're bleeding so much, you're losing a large volume of blood, and red blood cells carry oxygen, and so this is why you have shortness of breath. This is why you have a need to eat ice and flour, because you're deficient. You're deficient in iron. You don't have enough iron in your system. I'm like, what? So the fibroids caused me to be anemic, y'all. My level for my anemia was a 5. Yeah, it was like a 5. No bueno. Normal level is like 12 to 18. This is my hemoglobin, y'all. So low. So I ended up having to get I had to get iron infusions. I remember after that surgery I had to get iron infusions because he said that it's too low and you need to rebuild your iron up. So that's another sign that I had for my when I had my cycle. It was a sign that my fibroids were like really causing craziness. I began to eat ice all day long. I wouldn't have like a normal meal. Like ice would be my meal, and then in my mind it tastes like chicken. In my mind it tastes like ice cream. In my mind, so I would just dump this ice in my body, crunching it, messing my teeth up. Just oh my god. And I also had an appetite for flour. Flour, y'all. Flour, like self-rising flour from Publix. The flour with the yeast in it. Oh my God, my mouth will crave it. It will salivate just at the thought of having that flour. So I knew I was having some type of deficiency. Well, I went back to my doctor to get like a normal routine PAP annual, and he said that, I think you need to get another ultrasound. I'm like, okay. And again, the fibroids came back. So I had another surgery, but he also saw one of my tubes, fallopian tubes, filled with debris, liquid, something, hydrosplanix. So it caused damage to that fallopian tube, so I had to get it removed. So now I'm down one fallopian tube, and I'm getting fibroids removed. Then I had a repeat myomectomy. These are myomas. These fibroids are called myomas in medical terms. So I had a repeat myomectomy laparoscopically as well. I want to say these fibroids will come every 2 to 3 years. They will just show up again. They just keep showing up. My sister-in-law, she did give me some herbal supplements to decrease the pain and the fibroids from growing, but I'm so forgetful. I keep forgetting to take them. I still have them here, and I keep forgetting to take them. Craziness for me. So that was my second surgery. Then moved up here to Central Florida, and I haven't been to. I was seeing one doctor just to get normal checkups or whatever for my gynecological side, and she palpated my pelvis, and she was like, it looks very big, it feels very big. I'm gonna have to give you an appointment to get an ultrasound so we can see what's going on. Have you ever had this before? And I said, yup, I had this before, I know the drill. And so she was saying that I had to get surgery. And she didn't do surgeries, but her partner did, and her partner was actually the one that owned the practice. It was his practice, Dr. Foster. And so I went to him, and he, just like my first doctor, was so nice. Oh my God, super, super nice. And so he told me what he was planning on doing. He said that there were like 3 fibroids in there from what he saw on the ultrasound results. And so I Said, okay, I know the drill. But here is the twist. I'm not getting laparoscopic surgery. I'm getting a cesarean.
You're killing me, Smalls.
Because the fibroids have gotten so big, they are the size of a grapefruit. A size of a grapefruit, y'all. Size of a grapefruit. And it made sense because I would be looked at in a way to where people are like, you know, questioning, am I pregnant or not? I remember a kid, I want to say, in a grocery store that stopped and was like, are you having a baby? And I'm like, no, but it was a kid. So, you know, you never ask a woman if they're pregnant or, you know, because it's a lot of people that has a lot of different issues that you just don't know. You just don't want to throw it out there, you know. Women are 9 months pregnant, look 9 months pregnant, and that's how big their fibroid has gotten. So that was another clue to me that you might need to get checked out really for these fibroids. So when Dr. Foster said it's going to be a cesarean, I was like, oh snap. And I want to say around that time, I was starting to get to know my current husband, Alex. And one thing that I learned about myself for the surgeries that I had, the many surgeries that I've had, I come out of anesthesia really, really bad. Like, I remember hearing Cold Armstrong once when I was working in the NICU, and I asked one of the surgeons, what is Cold Armstrong? And they were like, oh, that's when somebody's combative during surgery, or when they're coming out of surgery during post-op, they are combative. And I'm like, oh, bro, I think that was me, because I'm coming out like, I think I remember my second surgery. After I woke up and came to, the side of my leg was hurting, my arm was bruised, I had a big bruise. I'm like, what the hell happened to my body? All I did was get a laparoscopic surgery. What the heck is going on with my body? Well, my friend who also worked the PICU that transferred to recovery, who was my nurse, told me, girl, you know, you get off the chain after surgery. And I'm like, what? She was like, yeah, I had to strap you back down because you were fighting. And not only did I have to strap you back down, but I had to give you sedation again to knock you back out, and then titrate it, wean it off slowly. And I was like, oh my God, I'm so sorry. I'm so sorry. I'm so embarrassed. She said, yeah, that's why you had those bruises on your body, because you was elbowing and hitting the rails of the bed. What? So I made sure after that surgery, I made sure I had to tell every single doctor or whoever that did any kind of surgery or conscious sedation or whatever, how I react to the sedation. Did not know it. If my friend never told me that, I wouldn't believe her. And I think she told me I hit her too. And I'm like, oh my God, I'm so sorry. She's like, yeah, no, I get it, because it happens to a lot of people. Oh, so this is common? What? Okay, so my bad, girl, my bad. So surgery happened. Alex was with me every single day, like literally at my bedside every single day. And I'm just like, what? I wasn't used to that. It was always my sister Tiffany with me. But Alex made sure he was in place every single day. So I'm just like, you know, this might be the one. He might be the one. And I just met him. Like, I want to say I've known him for maybe like 3 months. 3 months. And he was like, oh no, I'm going to stick beside her. I'm going to stick beside her. Yeah, right, that's him. I'm going to stick beside her. So that kind of gave me a different type of love for him. Like, that kind of opened up my heart to him a little bit more, maybe more vulnerable to him and not be afraid. So I came out of surgery, and with this surgery I had to stay in the hospital. The other surgeries were outpatient, so I could leave, but this surgery I had to stay in the hospital for monitoring, because this is a major surgery. This is them cutting me open and taking out huge fibroids. And Dr. Foster told me that he took out, when he came to see me, he took out 9 to 11 fibroids. I was like, hold up, I thought you said 3. The nurse told me, she said he took out a lot more than 3, but he ended up telling me, I believe he said 11 fibroids. 11? What? 11? Bro, 11? And he said that wasn't even all of them. There were other small ones that I just left. 11? Plus there were extra that you didn't even take out? And he said he also learned that I am allergic to morphine. And I also saw my reaction to it because I was in pain, so much pain. And when I woke up from surgery, my sister, Tia, was there, and Alex was on the other side. So they both were there with me. And I was like this. I'm itching. I'm pulling off the bandages off my belly. I'm like, oh my God, it's hurting, it's itching, everything's itching me. I'm itching everywhere. And that's after the dose of morphine. So I didn't know I did all of that. But the doctor was like, yeah, so we're gonna put that on your list of allergies. Yeah. The incision is still there, and I can now feel the area, because before it was like, it had no sensation, no feeling. I could punch it, pinch it, turn it, stick it, and I couldn't feel it at all. Now I can. Now I'm like, and this was in 2019, and I can feel it now. I can feel a little bit. It still feels a little like faint. It's not the same. I'm gonna just say that it's not the same. My incision is there, but he cut at the bikini line, so you can't even see the incision unless you look really, really close. So now I think I'm having that situation again. I spoke to one of my friends, a good friend of mine, and she literally told me last week that she's no longer going to deal with fibroids. She is having a hysterectomy. She decided she wants the entire uterus out. She needed to get herself a hysterectomy. She really wanted it. So I've been checking up on her to see how she's been doing, and you know, she's good. She said she's in good spirits. I don't know if I'm ready to have a hysterectomy. I mean, even when my cycle comes on, I'm like, I can't do this no more. This gotta go. This gotta come out. This gotta come out. And other moments I'm like, whew, well, not yet. Let me just keep my uterus a little bit longer. But it's really, really, really causing so much issues now. I'm not bleeding as much, but I do have those sharp pains, like pow, pow. And I'm like, yeah, those type of pains. This is just a little bit of my fibroid story. I know I'll probably have more at a different time, but I just wanted to tell you guys, you know, fibroids can cause a lot of mental stress. Fibroids can be painful. It can be painful during intercourse. It can be painful doing any type of heavy exercises. It can be painful if you are having a baby. It can change, because it's definitely, when you're having a baby, your uterus is growing and stretching, so these fibroids are being displaced or being, you know, pushed around, and it can cause pain in that sense. So I will talk about how people, I will talk about how people are managing the fibroids in a different video. So anyway, I'll probably go into more detail in another video as well. But anyway, guys, this is my fibroid story, and it's something I'm actually still living with. I hope you enjoyed the story, and I hope you have any comments or questions that you want to ask. You can put it in down in my comment section, and I can respond to it as soon as possible. Yeah, so thank you guys for watching. I hope you all have a great day. I love you. Deuces. See you next time. Peace out.